My name is Marc Hughes. I'm actually the owner of Franny's Pharmacy in Hickory, North Carolina. I use a full spectrum CBD tincture every day to help with stress and anxiety during the day. I've noticed that since I've been taking that, I'm more relaxed during the day. I also take it and use some other products like the healing salve when I have those aches and pains, and it seems to help with that too. So I take it because I feel like it's a natural product, and it's better for you as from a wellness health standpoint. I've been in healthcare for over 30 years now, and I've seen a lot of things come and go. And one of the most disturbing things I think that a lot of people, including myself, bought into was back in the 90s, the concept of controlling pain with opioids. And like I said, I bought into most of healthcare did buy into that. And now we're seeing the consequences of those with the opioid epidemic. And so when I was looking at cannabis and doing some research about cannabis, it made me feel better about using something natural. Not to say that pharmaceuticals still don't have their place, but if you can use something natural or lifestyle change or something that you're not having to use a pharmaceutical, I promote that first. Again, pharmaceuticals have their place. I'm a pharmacist. I believe in them, but I am also a minimalist when it comes to medications. There is a lot of misconceptions about using cannabis and CBD, especially here in the South. People know of the illegal substances and are confused about what we're selling. I would love for you to come in and talk to us about that, because we'd love to explain to you the differences between using hemp and using a product like marijuana cannabis, so that we can help you, educate you on the differences and the benefits of using the full spectrum from, say, the hemp plant. So if you're a customer or a person who is looking for alternatives to the traditional pharmaceuticals, I would encourage you to come in and talk to us and see what we're about and what some of the alternatives you could be taking. Of course, I would always tell you, you need to discuss this with your physician before starting any different kind of therapy. Our top selling product is actually the gummies. And I think it's because of our clientele tend to be women between the ages of 25 and 40. And they're really just looking for something to help them during the day when they get stressed out. But a lot of our customers use our gummies to help them fall asleep at night. I've had several customers come in and say they sleep like a baby when they take our gummies at night because it quietens the mind. It doesn't, from my aspect, it doesn't make you drowsy. It doesn't make you feel intoxicated, like if you take a Benadryl or something like that. But what it does is it quietens your mind, and it also kind of it's almost a full body relaxation. So that's probably our top selling. Our next two top sellings are the tincture. We have customers come in who are looking for relief on a constant level of pain or anxiety, and they tend to use our tinctures that way. We also sell a lot of salve. Customers who come in looking for joint relief or just muscle aches and pains tend to gravitate towards the salve and really like that, because we'll sample it in the store, and when they use it one time, they're like, yes, this, they'll come in, they'll use it, they'll hang around for a few minutes and like, wow, I can really start feeling this. And so that's the best selling right there. They get to experience it right there. So when you come into the Hickory store, the two young ladies that I have working for me and me and my wife, what we feel like is very important is listening to the customer. You got to listen to the customer. You got to see what do they want to accomplish with taking full spectrum CBD. Then you have to have that discussion of, well, how do you want to take it? Are you wanting immediate relief where you might want to smoke flower, or are you want to stay away from smoking, and you want to have something that's convenient? Then it might be a gummy. Do you want something constantly in your system for like anxiety or pain? So, we might gravitate towards the tinctures. So it's really listening to the customer and trying to figure out, okay, what is the best thing for their needs? My philosophy, and even from a medical background, really should be, let's use the lowest dose possible to get the effect that we want. Okay, so one of the things that I really like about the tinctures is that ability to titrate up. When we talk to a customer, we say go low and slowly increase it until you get to that sweet spot that you want for whatever you're trying to treat. However, on the other hand, we also think about the aspect of what we're taking care of. The studies have shown that patients or customers who come in wanting to treat pain, it tends to be a higher dose. And so we might start somebody out on the 500 milligram tincture to begin with. And we tell them, okay, start at 0.25 mLs. We show them on the dropper, the 2.25 mLs. Use it for 3 to 4 days, see what your effect is, and then you increase it if you need to the next 0.5. And then we also talk about, from a price standpoint, that if you start taking more than a full ml a day, you probably want to go up to the next bottle, because then you get a better price break at that. At the 1,000 milligrams, if you're at the 500, you get a better price break. So we talk about that. We also talk about how many times a day. There's a lot of products up there that say, take once a day. A lot of people promote once a day. I, on the other hand, I have trained my people to talk about taking it twice a day. I've done some research on this, and CBD lasts in the body probably between 6 to 8 hours. And so if you're only taking it once a day, you're really only covering part of your day. Now, if you're just taking it for sleep, that's fine. Take it, take your dose at night, and then that'll be fine. But if you're trying to, from a wellness standpoint, from an anxiety or pain, you probably want to take it twice a day. Well, as a customer, you should come into our store and talk to our bud tenders. They have been trained to listen to what you're trying to achieve, how you want to take the product, and they can answer a lot of the questions for you that way. If you come into the store, we're going to ask you first, what are you trying to treat? What do you want to accomplish with taking full spectrum CBD? The second question will probably be, how do you want to take it? Do you want immediate relief? Do you want a constant relief? Are we talking about taking it every day, or are you going to just take it as you need it? So we're going to have that discussion. Then we're going to talk about things like taste, whether you can take something under the tongue, sublingual, like our tinctures, whether you'd rather use the gummies, maybe you just want to relax in the evening and smoke some flower. Or maybe you don't. Maybe you're totally against smoking. So we're going to ask those questions and try to guide you into what you need to purchase for what you're wanting to accomplish and how you want to take it. So we would love for y'all to come to our store in Hickory. We're located on 127 in North Hickory, between Panera Bread and Salsaritas. Our bud tenders will talk to you, take time to see what you need, how you want to take things. If you have questions about taking the product that you want a little higher level discussion, I am a pharmacist, and I'd be happy to talk to you on the phone or meet you at the store to talk to you and discuss what your needs might be.